Hello, welcome to the second trimester pregnancy path group visit without the group. My name is Melissa, and I am the educator that leads the second trimester and third trimester group visits at both Swedish's First Hill and Ballard campuses. So, this is an attempt to provide you all with the important information that we typically go over in a group setting through this presentation here on YouTube. And just follow along. You might want to take some notes, and hopefully, it's new for me to do it this way, so hopefully, I can keep it interesting. Before we get into all of our topics, I just want to remind you all that there's a wonderful app called Circle by Swedish you can download, and it is providing you with tons of information throughout your pregnancy. Really answers a lot of questions. There's some nice handy tools that you can use. You can link it into my chart so that you can get appointment reminders, lab results, that kind of thing. So if you don't have it already, you might want to consider getting that app. Here are the topics that we're going to talk about today: routine care, testing and procedures of the second trimester, the warning signs of complications. That'll be preterm labor, preeclampsia, some other general warning signs. We'll talk about breastfeeding and also some things to do between now and delivery in preparation for your baby. Okay, so the tests of the second trimester, we do what is called glucose testing. We're testing for gestational diabetes in the second trimester. And the test that everybody gets is called a 1-hour glucose challenge test. And this, again, is to test for gestational diabetes, which is diabetes caused by the pregnancy in someone who has never previously had diabetes. And people that get gestational diabetes, it's a temporary state. It goes away after the baby is born. And so it's really just caused by the pregnancy. So the test that is done, the 1-hour glucose challenge test, usually between 25 and 28 weeks, is when we do the test. But the visit before the test, we send you home with a beverage, a bottle of some stuff called glucola, a very, very sweet, sugary beverage. And you want to put that in the refrigerator when it's given to you, and then keep it in the fridge until you're going to drink it. And you'll be drinking it about an hour before your 1-hour glucose test. You drink it at home, and you can eat normally that day leading up to the test. In fact, you should eat normally. Just do your regular thing in terms of food. And then drink the beverage about an hour before the appointment, and drink it, pretty fast, like 5 minutes or so. And then you come on in for your appointment, and we draw your blood about an hour after you drank this really sweet, sugary beverage. And we look at how does your body handle this giant load of sugar that you just consumed. So if the test results come back as normal, you are most likely done with any and all glucose testing. You don't have gestational diabetes. If your test results were to come back with high blood sugars, well, then we would want to do another test. And the other test, and it's only for people that basically fail the first test, is called a 3-hour glucose tolerance test. And with that test, you do have to fast for 8 hours before. And then you just come on in for your appointment, and we draw your blood right away, get a fasting blood sugar. You do drink a bottle of glucola, but this time it's in the clinic. And then we draw your blood every hour for the next 3 hours and look at over time what happens to your blood sugars. And yeah, it's hard just because you're hungry and you're getting your blood drawn, and all you've had is this really sugary beverage. So if the test results from that come back as normal, who knows why you failed that first test? If the test results from a 3-hour test come back with high blood sugars, you're diagnosed with gestational diabetes, and you are going to meet with a nutritionist who will help you learn to manage, dietary things to manage your blood sugars throughout any given day. You're usually given a glucometer so you can check your own blood sugars throughout each day. And in some cases, women with gestational diabetes do have to be put on medications to manage that. But usually it's just managed with some dietary changes and maybe some exercise. So another thing that we test for late in the second trimester is anemia. And that just means low iron levels in your blood. And there are some signs of anemia. Somebody who is anemic might feel really weak and really tired a lot of the time. They might have paler skin than usual. They might have really cold hands, really cold feet. Some people have some shortness of breath. But not everybody has signs, and so we always check for this. And it's also checked for in the first trimester. And really, with any levels of anemia, we put you on an iron supplement, and that would be in addition to your prenatal vitamin. So if any of you are put on iron supplements during pregnancy, it's a really good idea to take the iron supplement separate from your prenatal vitamin at opposite times of day. And that's because most prenatal vitamins have calcium in them, and calcium can inhibit your absorption of iron. And vitamin C can actually enhance your absorption of iron. So if you're on iron supplements, it can be a good idea to take the iron supplement with a glass of orange juice. And then also try to eat some extra iron while you're pregnant, just to help avoid anemia. And good sources of iron are meat, meaning red meat, chicken. Fish also is a good source of iron, and that includes shellfish, eggs, chickpeas, leafy greens, and also dried beans like black beans, white beans, and also lentils, and then also nut butters like peanut butter, almond butter. So those are just some things to maybe try and eat more of. And then if you have Rh negative blood, which most people do not have Rh negative blood, but if you are one of the people that does, then we're going to do an Rh antibody screen also at approximately 28 weeks, possibly a little before. And then everybody is offered the Tdap vaccine early in the third trimester. And so this is just kind of a looking ahead reminder about that. Tdap stands for tetanus, diphtheria, and pertussis. And you've probably all had this vaccine before, but we like to give it to women in the third trimester of pregnancy because it's thought that the antibodies in that vaccine will cross the placental barrier and get to the baby and give the baby some level of protection against those illnesses. Babies are born with really immature immune systems, and it takes them at least a couple months to develop much of an immune system. So this is just giving them some extra protection. And it's good for the partner to make sure they're up to date on their Tdap vaccine. And if you have any other family members that are going to be in close contact with the baby, maybe staying with you, it's really good to make sure that they're also up to date on their Tdap vaccine. Okay, so most of you during the second trimester, probably all of you in fact, are gonna start feeling your babies move. And so fetal movement usually starts, or you start noticing it somewhere between 18 and 22 weeks of pregnancy, sometimes a little sooner than that, sometimes a little later than that. It's kind of elusive at first, just these little, almost feel like gas bubbles or twitches. Flutters, and it becomes more and more obvious because your baby is growing all the time. And so you start getting kind of familiar with what seems normal for your baby in terms of movement. All babies are very different. Some babies move more than others. Babies, though, they do move all day long, so they have periods of being awake, periods of being asleep, and you may notice these patterns of where certain times of day or certain things that you do that seem to inspire your baby to move. And it's good to just kind of be in touch with that and sort of pay attention to that a little bit. And if you were ever worried about movement, and this would be after 28 weeks of pregnancy, because most babies don't have a very distinct pattern up until about 28 weeks. If you were ever worried about movement, you can always do something called fetal movement counting. So like, let's say you had a day where you thought, I haven't been feeling the baby move as much today. Just kind of a good way to check in with the baby is to sit down and do a little fetal movement counting. And so you would drink a glass of juice or have a piece of fruit, basically have something sweet, because babies often respond to sugar. And so, eat something or drink something that is a little bit sweet, and then sit down and put your hands on your belly and just count how many times your baby moves. And for movement, you can count kicks, twists, rolls, turns, twitches, and hiccups don't count, but they're certainly a good sign. And what would be normal if you were doing fetal movement counting, so you're dedicating that time, would be to feel 5 movements in 1 hour or 10 movements in 2 hours. And if you did not feel those numbers of movements and you were dedicating this time to fetal movement counting, you would want to give the clinic a call. So yeah, that's just a tool for you. There's a fetal or a kick tracker on the Circle app that will help you keep track of movement if you're doing fetal movement counting. And then there's also you can just use a pen and paper to keep track of movements as well. So yeah, just a little tool available to you guys. So we're going to talk about complications of pregnancy, and the vast majority of people don't have complications. So I don't want anybody to freak out about this information, but it's good to know the signs of a couple of the complications that we like to avoid. So the first one is preterm labor. The definition of preterm labor is labor before 37 weeks of pregnancy. 37 weeks is when most babies are thought to be fully developed and ready for life outside of the uterus. And before 37 weeks, there's always concerns that, baby is not quite ready to be out here yet. And then that can result in some extra time in the hospital. So having said that, if you went into labor at 36 weeks, typically no one's going to try and stop your labor. Most babies born at 36 weeks, they're maybe a little bit on the small side, and they might have to work harder to learn how to eat, but are usually able to go home from the hospital with their family. But any baby born at 35 weeks or less is definitely going to be spending some time in a neonatal intensive care unit, otherwise known as a NICU. And the further below 35 weeks you get, usually the more time in the NICU for the baby. So knowing the signs of preterm labor just means that if you were to experience these, you can call us earlier rather than later. The thing about preterm labor is that if it's caught early enough, it might be able to be stopped. And the other option, of course, is if it's caught early enough, it might at least be able to be delayed by a day or two. And that can actually make a big difference to a baby that's going to be born early. So that's why we like you to know the signs of preterm labor. So before we get into the signs, I just want to talk for a moment about Braxton Hicks contractions. I don't know if any of you have heard about these or not, but Braxton Hicks contractions are a normal part of pregnancy. Your uterus is a big muscle, and so it contracts throughout the pregnancy. That's how it exercises, that's how it grows. And so these contractions, again, very normal. They're usually very short and kind of sporadic, and you may not even notice them. There are lots of people that will go their whole entire pregnancy and never notice a Braxton Hicks contraction. But I like people to be able to recognize them because I think it gives you a little bit of a leg up on recognizing preterm labor contractions if they were to happen. Because, in some cases, Braxton Hicks contractions, if they're not going away and they're intensifying and they're just demanding more and more of your attention, it's possible that they are preterm labor contractions or turning into that. So that's why it's good to be able to recognize Braxton Hicks contractions. So what you all can do right now, if you're in a good position to do this, is kind of kick back in your chair, if you're in one, and spread your fingers of both hands and then place those on your belly, kind of like the picture here, but maybe with the fingers a little bit farther apart. And then just with your fingertips, try to see if you can dent your belly with your fingertips. And I'm guessing that you all can dent your belly with your fingertips. I'm guessing that that's something most often people can do, just in a random asking to do that. So if you can dent your belly with your fingertips, you're not having a Braxton Hicks contraction. If, however, you could not dent your belly with your fingertips, if your belly felt kind of the consistency of, say, your forehead, if you tried to dent that with your finger, then that would be a Braxton Hicks contraction. So it can kind of be all over the belly, or it can just be kind of in a swath across the lower belly. And Braxton Hicks contractions, your belly just feels really tight and hard, kind of a squeezing sensation. So, yeah, in your spare time, just put your hands on your belly, see if you can learn to recognize these if you can't already, and or if you ever just feel kind of a sensation that it seems unusual, you can always do that little fingertip test. So let's say that you are able to recognize Braxton Hicks contractions and you have a day where you're thinking, I'm having a lot of contractions today. And so you decide to count and you notice that you're having 6 or more in 1 hour. If that were the case, what you would want to do is drink 3 to 4 big glasses of water, empty your bladder, and then lie down, preferably on your left side, and count contractions for a second hour. If you continue after drinking all that water and getting off your feet to have 6 or more contractions in a second hour, then you would want to give the clinic a call. We most likely want to have you come in and see you. Now, if after drinking all that water and getting off your feet, you have fewer than 6 contractions in the second hour, well, you can pretty safely assume that maybe you were having all these contractions because you might have been dehydrated. Dehydration can cause contractions. And so it's one of the reasons it's very, very important to stay well hydrated every single day through your pregnancy. It also might have been that in addition to the dehydration, you were had a really maybe crazy day. Maybe you'd been on your feet for hours and hours with no rest, and you'd had some stressful stuff going on along with a little dehydration. It could have been a combination of all those things. So drinking all that water and getting off your feet is just a really good test, because true labor contractions, whether they're preterm or full term, they really don't go away no matter what you do. They just keep on coming. So it's a good test. Now, another sign of preterm labor would be a gush or trickle of fluid from your vagina. You have an amniotic sac, and for most people, their amniotic sac, or water as it's commonly called, does not break until they're well along in labor and probably full term. But in a small percentage of people, they will have their water break to start their labor. And yeah, that of course is an even lower amount to have that happen preterm. And so when the water breaks, it can break in either a gush of fluid or a trickle or many trickles of fluid. So the gush is kind of obvious. Most people initially think when their water breaks in a gush that they wet their pants. So yeah, if you have all of a sudden a sensation that you just wet your pants and that's not something that's normal for you to do, then yeah, it's probably amniotic fluid and you need to call the clinic immediately. And in some cases, though, somebody's water will break and it'll just be a trickle of fluid, and it'll be a trickle, and then maybe it stops for a while, and then a little later there's some more trickles of fluid, and you kind of keep trickling fluid. Basically, any suspicious fluid coming from your vagina, it is always a good idea just to give us a call, because it's really easy to have you come in and get a sample of that fluid, and we can tell if it's amniotic fluid or not. But the amniotic sac is a barrier against infection, so that's why this is really important. And really the bottom line, whether it's second or third trimester, is anytime you suspect your water has broken, you always want to call right away, with or without contractions. So the next sign is a watery or heavy mucus discharge that might be blood tinged. Now, a watery discharge, it's possible that's the trickle of fluid that I just mentioned. And so, if it's a different, very watery discharge that's not normal for you, that would be a reason to call. Now, a mucousy discharge, so the neck of the uterus is called the cervix. And during your pregnancy, for most of your pregnancy, it's long and it's thick and it's closed. And the baby can't leave the uterus because the cervix is really in the way. Now, what happens when somebody is starting to go into labor, and sometimes even a little before labor, is the cervix will start to change. It'll start to shorten in its length, and it'll start to open a little bit. And there's this mucus plug in the cervix. So if the cervix is starting to open a little bit, you can dislodge parts of the mucus plug. So yeah, just a really mucousy discharge with blood, little blood. And yeah, if you're before 36 weeks, we definitely want to know about any thick mucousy discharges. And if you're after 36 weeks, then it's considered a preliminary sign of labor, and you would just watch for other signs of labor. Vaginal bleeding, anything heavier than spotting, that's always a reason to call. Menstrual-like cramps. Some people, when they start having contractions, they will describe them as feeling like menstrual cramps. And so, if you were to have a sensation of menstrual cramps, and you can just put your hands on your belly, and again, if every time you feel this menstrual cramp sensation, if you can't dent your belly with your fingertips, then those are contractions, and you would count them in the same way as mentioned above. And then intermittent dull ache or pressure in your lower back, upper thighs, or pelvic area. And, that's a little more vague. Some people, in their first sign of preterm labor, might just be kind of this pressure feeling that they don't normally have, and that it just is not seeming right to them. So, I think the message with that really is that it's always okay to call. If you're worried, it's better to call and talk to somebody and possibly be seen than worry. Now, in the case of an intermittent ache, that it's possible in any of those areas, lower back, upper thighs, or pelvic area. It could be contractions. And so, again, if you're feeling something kind of intermittently, like back pain that's increasing but coming and going, put your hands on your belly. And if you can't dent your belly, then that means those are probably contractions, and you should count them in the same way as talked about above. And then diarrhea and or upset stomach. Some people in the days leading up to labor will have diarrhea, and with that, some upset stomach. And it's the diarrhea, it's really nature's way of clearing out your lower digestive tract to make more room for the baby that has to pass right on by there. So at this point in the second trimester, if you had a day of diarrhea and none of these other signs, it's probably something you ate. But if it doesn't pass with if the diarrhea doesn't get better within 24 hours, or if you're having the diarrhea and upset stomach with some of these other signs listed above, then you would want to give a call. So you don't, worry excessively about the signs of preterm labor. It's just to kind of know them, have them in the back of your head, and don't hesitate to call if you are feeling any of them. So another complication that can occur in a pregnancy that we like to keep an eye out for is something called preeclampsia. Preeclampsia is high blood pressure caused by the pregnancy. So kind of like gestational diabetes in that it's a temporary state and it goes away after the baby is born. And our part is we take your blood pressure when you come in for any prenatal appointment, and we are just kind of tracking your blood pressures throughout your pregnancy. But there are a few warning signs of preeclampsia that it's good to be aware of, and those are developing a severe persistent headache, a really bad headache that is not going away no matter what you do. It's not going away with rest, with sleep, with maybe taking some acetaminophen. It's persisting. That would be a reason to call. Also, another sign of preeclampsia is visual disturbances. All of a sudden your vision has gotten really wacky. You're seeing spots or floaters, having double vision or blurred vision. And then another sign would be extreme swelling, especially in the face and the hands. A lot of people will have some swelling in their ankles and their feet, especially in the warmer months of a pregnancy. Swelling of preeclampsia usually involves the face, and it can come on very suddenly. So, you catch a glimpse of your face in a mirror, and if it's all of a sudden kind of a puffball face, you've got a lot of swelling, especially under the eyes, and your hands are swollen too. That could be a sign of preeclampsia. So really, with any of those things, you would want to give the clinic a call. Now, there are some other general reasons that you would call. Fever over 100.4 degrees Fahrenheit. That could be a sign of an infection, so we would want to hear from you if you developed a fever. Pain or burning with urination, that can be a sign of a bladder infection or a urinary tract infection. And we always want to get those treated pretty quickly if they come up during pregnancy. And then vomiting or diarrhea that lasts 24 hours or more. The concern there would be dehydration, so you would definitely call for that. And then we talked already about babies' movements and, how you can also kind of keep track of movement if you're worried. But yeah, if there was a really big change in their normal pattern of movement, or you hadn't felt any movement for a number of hours and you'd done fetal movement tracking, and you had felt fewer than 5 movements in 1 hour, or 10 movements in 2 hours, that would be another reason to call. So yeah, again, try to not worry too much about complications during your pregnancy. For most people, it's a very healthy time of life, but most complications, it's best to catch them earlier rather than later. So just don't hesitate to call if you have anything that you're worried about. Okay, so let's talk about breastfeeding. Breastfeeding is recommended by the American Academy of Pediatrics. It's their recommendation is that you feed your baby exclusive breast milk for the first 6 months of life. You're usually then introducing some solid foods around 6 months, and then the recommendation is that you continue to breastfeed for the baby's first full year of life, and then as long after that as you want to. And in that second 6 months of life, though, yeah, they're getting solid foods in addition to the breast milk. The reason for that recommendation is that the benefits of breastfeeding are pretty amazing. For the baby, it's protective for the baby. Breast milk is alive. It has antibodies. And so the mom passes these antibodies that she has to the baby through the breast milk. And that gives the baby lots of protection against illnesses and infection. In fact, the first milk that you produce, called colostrum, it coats your baby's gut with a protective coating to help prevent illness. And yeah, breastfed babies have much lower rates of gastrointestinal illness, upper respiratory infections, and ear infections than formula-fed babies. And then those benefits go on longer than that. So breastfed babies, they have lower rates of obesity, allergies, asthma, diabetes, childhood leukemias, and lymphomas. And then, of course, in those early months, breastfeeding your baby actually, it cuts the risk of SIDS in half, which is pretty significant. Breast milk is also very easy on a baby's immature digestive system because breast milk is incredibly digestible. And then it's also good just for their general overall growth and development. Breast milk, it changes constantly to meet your baby's changing nutritional needs. And that's a pretty cool thing. And then for the mom, it's good as well. It helps the uterus contract in those early days after delivery to help control bleeding. The women who breastfeed have lower rates of breast and ovarian cancer later in life. Long-term breastfeeding, meaning breastfeeding past the first year, it actually lessens the mother's risk of type 2 diabetes, osteoporosis, heart disease, and high blood pressure. The recent study has found that women who breastfeed actually get more sleep and better quality sleep than those that don't breastfeed. So that's certainly a great reason to breastfeed. And then it's also really good for the family, for the environment, for the wallet. Breast milk is free, and it comes out, ready to serve, the right temperature, and it certainly, there's no waste created with it, so that's a good thing too. So, what we do in the hospital, if your baby is born full term and it's a vaginal birth, what you can expect is that at that moment of birth, when the baby comes out, the doctor or midwife will catch your baby, and then they're just going to place him immediately skin to skin on your belly or chest. And we do this because it's really, really good for the baby. It helps the baby adjust to this new environment. The mother is familiar, and so it's a very comforting place for them to be. So it will help them figure things out faster, like how to breathe and how to stay warm out here, and how to regulate blood sugars, and regulates heart rate. And then it also, of course, kind of sets them up and provides the best environment for them to figure out how to eat. And most babies will start showing some signs that they are thinking about eating or wanting to eat in that first hour after delivery, like very commonly between 30 and 60 minutes after delivery. So that's usually when the nurse is going to help you get started with breastfeeding, get your baby latched on the breast. So ideally, that first feeding does happen in the first hour because we know that that sends a very strong message to the breast to start making milk. The baby is here. And then what you want to continue in order to build a good milk supply is continue to feed your baby at the breast whenever they show you that they're hungry. And babies show us that they're hungry in lots of different ways. They usually start out kind of quietly. They might just toss their head from side to side a little bit, open their mouth, and root a little if something especially is touching the side of their cheek or their lower lip. And they might smack their lips together. Babies certainly will cry to tell us that they're hungry, but crying is a late sign of hunger. So if you have a baby that is crying because it's hungry, it's probably already been telling you for at least 15 minutes in other ways than it was hungry. And when you're first learning how to breastfeed a baby, it is a lot easier to get them on the breast before they're crying. So good to try and catch those early cues of hunger. It's just going to make it a lot easier for everybody. And the exception to that would probably be the middle of the night, because that's most likely when crying will let you know that the baby is hungry, because hopefully you'll be getting some sleep. So yeah, the thing about establishing a milk supply is basically sending the message to the breasts to make milk. And the way that that happens is when milk is removed from the breasts, more milk is made. Very simple demand and supply system. More milk out of the breast means more milk coming in. And that message is particularly strong in the first 3 days of a baby's life. And so even though a lot of babies can kind of be sleepy and you just gave birth and are maybe feeling kind of physically exhausted and emotionally overcome, it is a really important time, those first 3 days, to really work on laying the foundations for a good milk supply. So yeah, feed your babies whenever they're hungry, and you should aim for at least 8 to 12 feedings every 24 hours in those early weeks. And in fact, 10 to 12 feedings every 24 hours would be ideal. And so lots of feedings. And another thing that you can consider doing, which may surprise you that I'm going to say this, but in addition to having your baby at the breast all those times every day, in the first 3 days only, it can be a really good idea to do some hand expression of the first milk. Again, that's called colostrum. And so, yeah, just doing some hand expression. The mom can do it, the partner can do it, whoever wants to do it, and just getting some extra milk out, because it just will bring your milk in faster, and it will also make it easier for the baby to latch on the more milk that you have. And actually, the more milk that's removed in those first 3 days, it actually will help you ensure a good milk supply in the future. We just know that it makes a difference, like in terms of how much milk you're making when your baby's 2 months old, if there was a lot of milk removed in those first few days. So so just hand expression in addition in the first 3 days. But yeah, lots and lots of time at the breast, and no scheduling of feedings ideally. And then there are some great films, by the way, that you could check out for learning a little bit more about breastfeeding. Some good websites, and one is the Stanford University breastfeeding website, and they have some films like how to do hand expression, how to get a baby latched on the breast, and these would be good things to check out. So while you're in the hospital, you can plan on having your baby with you the entire time. That's called rooming in. And that's what we do. Generally, the only babies that would go to a nursery would be babies that had medical issues that could not be dealt with in the room. And then they would be going to a medical nursery, such as a NICU. And otherwise, plan on having them with you the whole time, because that's how it goes for most people. And that's actually really, really good for many, many things. It's good for you leaving the hospital feeling like you know how to take care of the baby. It's also really good for breastfeeding, because if the baby is with you, then you're going to notice their signs that they're hungry, and you're going to feed them more often at the breast. And then it's also certainly very good for security for the baby while they're in the hospital. Now, the other thing a lot of people are concerned about with breastfeeding is breast pumps. And why my recommendation to you all is that don't worry so much about having a breast pump right now, but certainly check into what your insurance covers. So you can either go directly through your insurance company. There's another option would be pumpingessentials.com. That is a website that if you enter your insurance information, they can let you know what is covered by your particular insurance. And just know what's covered and be sort of poised and ready to get a breast pump at some point after delivery. But yeah, don't worry so much about having it ahead of time because you don't really quite yet know what you need in terms of a breast pump. There are some people that absolutely need to rent a pump. Those are hospital grade breast pumps that a person might rent, and those are more powerful pumps than the ones that you purchase. So somebody, say, with a baby in the NICU would need a hospital grade breast pump. And if your insurance gives you the option of either a hospital grade or a purchase pump, you don't want to use the benefit up ahead of time by getting the purchase pump at, say, 35 weeks and then finding out later you need a rental pump. So I would say just kind of know what your options are and where you're going to get a breast pump, but don't worry about having it quite yet. Having said that, we will give you a prescription for a breast pump, which is required by most insurance companies. We'll give you that in the third trimester at a prenatal visit. And then breastfeeding, in terms of, it's hard. I'd say, think most people will tell you that have breastfed that the first few weeks are difficult and, a lot of adjustment. And you're, of course, getting used to having a new little person in the house, and there's a lot of emotion around that, and again, a lot of physical healing, and then you're also learning how to feed your babies, and it's almost like the equivalent of a full-time job for a while. So in the hospital, your breastfeeding help is going to come from your nurses mainly, and we do have lactation consultants available that will see people that are having problems with breastfeeding. And sometimes things are going okay in the hospital, but then you might get home and feel like you're having problems with breastfeeding. And so we have lactation consultants, and we're really limiting in-person visits right now, but we'll have virtual visits and also certainly phone visits. And there's some reasons, some very distinct reasons to actually seek out help and call and speak to a lactation consultant. And so those reasons are, if you are at all concerned that about making enough milk, like if you think that you are having some issues with milk supply, that would be a reason to call. Or if you feel like you're concerned that the baby is not getting enough to eat, that would be a reason also to call. If you have nipple soreness, nipple pain past the first week, a lot of action at the breasts, and it's a new thing, so a lot of people will have some tenderness in the first week of the baby's life, but that usually resolves. And if it's still persisting past the first week, you would want to call and talk to somebody at the very least. It might have to do with the baby's latch, or in some cases an infection. Another reason to call would be if your breasts are not feeling fuller and heavier by day 5 after delivery. So we talked about that colostrum. That is present at birth, and that's your baby's first food. And that's what they eat for the first couple of days until your milk starts coming in. And most people's milk starts coming in somewhere between day 2 and day 5 after delivery. And by the way, the more feedings you do and the more milk that's removed in those first couple of days by the baby, and also possibly your hands, that will bring your milk in faster usually. So if your breasts are not feeling fuller and heavier by day 5, because that's when your milk starts coming in, they start feeling fuller and heavier. So if you're not noticing really any difference at all, and sort of the consistency and the feel of your breasts by day 5, that would be a reason also to call. And then if you had extreme engorgement. So engorgement is when your breasts get really, really, really hard and firm and really, really large. And it's common to have some engorgement on day 5 or 6 after delivery. It usually resolves within 24 to 48 hours. And if it's not, If it's still extreme, then that would be a reason to call a lactation consultant. So Swedish has outpatient lactation services available at Ballard, at First Hill, and also at Issaquah. And again, just don't hesitate to reach out. We also commonly have breastfeeding support groups at those 3 locations, which are not currently being held. But again, we're here in the second trimester, so who knows, maybe those will be back on board and you'll want to check back about those after you've had your babies, because breastfeeding support group can also be a very, very helpful thing. So, last things to talk about. There's some things you can do right now in preparation for your baby and some things that we recommend that you do. So one is, by 35 weeks or so, you're going to want to have a car seat, and you will want to get it out of the box and read the instructions and practice getting it in your car. Now, about 93% of car seats are not installed correctly or used correctly. And since that's almost all of them, it is a really important thing to get your car seat inspected by a certified car seat technician, or take a car seat class, which, we're not doing in-person classes right now at Swedish. We do normally have a car seat class, and I think there is possibly a plan for getting one online, so you might check back about that. But otherwise, go to this website, safercar.gov, and they can tell you where you can get an inspection done by a certified car seat technician, special people that know a lot about car seats. And honestly, I don't really know currently how many car seat inspections are being offered either. So, but that is something to check. And again, because we're in the second trimester, hopefully by the time you guys are well into the third trimester, that will certainly be an option. Another thing is, we need you to choose a doctor for your baby. An OB or a midwife, they cannot take care of your baby after it's born. So you'll need to have somebody picked out for longer term, just well baby visits. And you could pick either a pediatric group or a family medicine group for this. And usually all you can get figured out in advance is the name of the clinic. They don't usually assign a specific doctor before delivery, but at least figure out which clinic you want to take your baby to after delivery. You'll be asked for that information in the hospital during labor, and we need this because we do some screening tests on your baby in the hospital. We've got to send the results somewhere, and you take your baby in to see their doctor usually within about 3 days after delivery. So again, just pick a clinic. And then FMLA forms, family medical leave. So if any of you are either or both parents are planning on taking family medical leave, there's some forms that you need to get from your employer, and then you would bring them into a prenatal visit and have the doctor or midwife fill those out. If you're planning on returning to work at some point, it's really not too early to look into childcare options. In fact, it might be a little late. Seattle is historically kind of a difficult place to find childcare. So usually you want to explore these options during pregnancy, and the earlier the better. In fact, some people are getting on waiting lists before they're even pregnant. So if you haven't started looking yet, I would say start now. And care.com is a website that will provide some excellent information about childcare. So Swedish offers a bunch of birth and family education classes. And again, because of the group situation, they're not doing groups right now. We are not holding in-person classes, but we will have momentarily some online class availability, where we've been converting things to online classes. And literally, as I'm recording this, those things are in the works, and they're not quite up yet. But check the Swedish website, because by the time you guys listen to this, it's possible that those are posted online. So we'll be offering online anyways, childbirth education, newborn care, breastfeeding. There's an infant safety class, and possibly some others too. So, just keep an eye out for that. And otherwise, again, we typically offer many, many, many of these classes at different locations in person. And so by the time you guys are getting closer to delivery, those options may be back. So I guess that's a thing you should just keep posted about. And then doulas. I don't know if any of you thought about hiring a doula, but it's something I very much recommend. A doula is a professional labor support person. So you would choose them and hire them and get to know them a bit while you're pregnant. And then they're going to join you in labor as early as you want them to and provide continuous hands-on labor support. And having a baby is a big deal. It's not something that happens every day. And so it's really nice to have that extra support for both parents because, yeah, it's a huge physical event, obviously, for the person in labor, but it's a huge emotional event for both parents. And so very reassuring to have a doula there. And there are many doulas in the Seattle area. It's kind of the doula capital of the universe. But Swedish has their own doula program. And yeah, we have about 60 doulas that we've hired and vetted, and they're a great group and really familiar with the hospital. But you could bring in a doula from anywhere. And I would say check the Swedish website, swedish.org/doulas, and a lot more general information about what doulas do and what they don't do and what are the benefits, and certainly a lot of information about the Swedish doulas. And Swedish does make it very easy to get a doula. So yeah, it's just something for everybody to consider, no matter how you envision your labor and delivery going. It's anybody, even somebody who's planning, say, on having an epidural, still would greatly benefit from a doula. So definitely get some more information about that, and I recommend that you consider it. So that's the end of this presentation. I hope it was helpful to you all. And if you have additional questions, your best bet for getting those answered is going to be going to, sending a message to your doctor or midwife through my chart, or you can, keep a list of those questions, and when you have your next appointment, ask your provider at that time. And that's what we've got here today. And I will maybe hope to meet some of you in the future at an in-person third trimester group. And if not, there'll be a third trimester YouTube presentation just like this one. So yeah, you'll just have to check back. But I wish you all happiness and health through the rest of your pregnancies. Thank you.